In this video we will talk about pregnancy week 25, 26, 27, and 28 weeks, i.e. from 25th week to 28th week. What changes come in your baby during your pregnancy? What important changes do you have to face for you? Plus what can be the tips which if you follow, then your pregnancy will go smoothly. So watch this video till the end, and I will say again, if there is any pregnant lady around you or there is any pregnant woman in the house, then do share it with them. So let's now talk about the 25th week, i.e. about week 25. The growth rate of the baby in week 25 is now more. I told in the previous video that the growth rate of the baby in the beginning, the baby's 16 to 18 weeks, are limited only to organogenesis. Meaning his organs are developing, but in the phase after that the growth of the baby happens rapidly. So now our baby is about the size of a cabbage leaf and weighs around 1.5 pounds on an average. The skin of the baby starts becoming transparent, which means that earlier the skin was very thin, but now blood vessels are developing in it. So slightly pink color starts appearing in the skin. The fat around the body of the baby increases, so that it gets help in temperature regulation properly. The baby can regulate its body temperature. The baby's heartbeat can now be heard with a stethoscope or a Doppler machine. The baby's heartbeat can be easily localized at this time, and can be heard. Pregnant women can hear the sound of the baby's heartbeat because the baby's heartbeat is also being heard by a stethoscope. The growth is good and the uterus is also growing inside, so your belly is becoming more visible, and when you go to the doctor, when they mark, your belly now almost reaches the upper part, due to good blood flow in your body. You very commonly present dry skin, along with dry skin and itching, that is also common. You can have all these symptoms like acidity, constipation. Around this time period, your breasts become full and you can feel heaviness. Some people also see white discharge from the breasts. So my tip for 25 weeks is that you have to manage whatever symptoms you have, or you have to balance them. Then for dry skin you can apply a mixture of coconut oil and moisturizer. If you hemorrhoidectomy will help in your motion, plus Isavgol is available in the market and is easily available in every shop. You can include it. You have to include all these things. Increase salads, increase seasonal fruits in your diet. We do not prefer giving laxatives, i.e. medicines for constipation. It will be cured with more medicines. First of all, bring changes in your food and drink, plus increase your activity a little. If you do not do exercises, then you can start that. Mostly, pregnancy constipation gets cured with all these things. In 25 weeks, due to your stomach moving more forward, there are postural chances in the body, due to which you may have back pain. So for that, I have already explained the tips in previous videos. So let's talk about 26th week of pregnancy. In the 26th week, your baby is growing more. His senses are getting refined. He is able to hear better. Now the baby's eyes start opening slowly, and he starts perceiving light. He starts feeling a little difference between darkness and bright light. Your baby's lungs are also maturing. As I said, surfactant is a liquid that helps in keeping the lungs swollen. He is developing. The baby is also practicing breathing movements. But at this time his lungs are not mature enough to survive outside if delivery takes place, or be able to do breathing movements outside. Your baby in the 26th week of pregnancy will now, it also crosses the umbilicus and is visible at a level above it. Now the baby's heartbeat is heard through the stethoscope or the Doppler machine comes on, due to which you start feeling the baby movements more strongly. Your legs may have swelling, plus if you have any medical problem, i.e. you have less blood in your body, or you are developing BP, then you may also have more swelling in your legs. Swelling does not happen so much only due to postural reasons, but in that also you can do this, that you take breaks in between. Keep your legs elevated a little bit, i.e. keep them lifted up. If you are sitting on a chair, then sit with your feet on a stool. Do not sit hanging down. Do you have such a job in which you have to sit the whole day or stand in between? You can take a walk. You can change your posture. You can massage your feet while sleeping at night. If you start practicing all these things for your feet now, if the swelling is mild, then the swelling does not increase further. Plus you know how to manage it. Once the swelling increases a lot and you face difficulty in walking, then that swelling never goes away completely. If you have to be troubled by it daily, then it is better that you can massage your feet daily with a moisturizer, and while sleeping, You can keep a pillow under your feet so that the feet remain elevated and whatever daily fluid collection is there in them or the blood that has collected can be cleaned completely. So the second tip to reduce swelling is that you can wear comfortable shoes so that you should not have pain in your heels and legs. Wearing uncomfortable ball shoes can sometimes cause back problems. Heels and heeled sandals and all these things can be a little risky. If you have not started exercising yet, then start exercises, meditation, relaxing techniques, etc. So this was about 26 weeks. Now let's talk about the chances of your baby developing in 27 weeks. By 27 weeks, the baby is growing bigger, his muscles are getting stronger and fat deposition in the body is also increasing, day by day. Due to this reason, the baby's weight is also increasing. By this time, the baby's weight becomes around 900 grams. The baby's brain is also developing and now he is able to control his whole body better, his sleep cycle is developing. Many times, patients say that they do not feel the baby's movements, 2 or 3 hours pass by. So, it is like this that the baby sleeps inside and his sleep cycle continues. So when he is in sleeping position or he is sleeping, you do not feel the movements. The baby is now able to close and open his eyes properly. He has control over his eyes, it starts to move. And he already has sensitivity to light. At the 27th week, the eyes of the baby are different and they start shifting upwards. The mother starts feeling very strong baby movements at this time. So after the 27th week, doctors generally advise that you keep an eye on your baby movements. You should feel at least 10 fetal movements daily. Anything more than that can happen, but if you feel less than 10 movements, then it indicates something. The baby may be compromised inside somewhere. So that is why if you are feeling less than 10 movements, then you must visit the doctor. As I said, your uterus is getting bigger. So again, that pressure on the urinary bladder due to which you may have the problem of frequent urination. My tip for 27 weeks is that you continue to maintain your hydration. Maintain the hydration of the skin. Keep applying moisturizer. You can mix olive oil or coconut oil in your normal moisturizer and massage it 3 to 4 times a day. Keep your body a little active so that problems like constipation, acidity, etc. do not come. After 27 weeks, we advise you to get a second dose of tetanus injection. If you have got the first dose only and not the other 2 doses, then nowadays vaccines have come in triple combination. So the vaccine comes in triple combination by Tdap, which contains vaccine for diseases like tetanus, diphtheria, and pertussis. This is for the protection of the baby. You can get it done at 27 weeks for this. This is about 27 weeks. Now let's talk about 28th week of pregnancy. In 28th week of pregnancy, your baby's weight is almost 1 kilogram and he is developing very speedily now, refining his final stages of development. Other internal organs like heart, lungs, intestines are also in their last stage of development. In 28th week of pregnancy, the mother's belly is growing up to about 4 fingers above the amniotic fluid. Due to stretching, stretch marks can develop and skin can remain dry. Constipation is a common problem and frequency of urine. Frequent urination can also be a common problem. At this time, if you suddenly change your posture, if you are sitting and stand up or if you are lying down and stand up, then suddenly you may feel severe pain. My tips for 28 weeks are that you should keep your movements a little gentle. Whatever position you are changing, do it slowly. If you are lying down, first turn on your side and then sit and then you can stand. Take 1 to 2 minutes for this. If you stand up suddenly, your BP may also fall, orthostatic hypotension, which we call it, due to which the patient also feels dizzy. At this time, many doctors prefer getting a growth scan and color Doppler done so that whatever is the status of the baby inside, we can know what is the chance of water in your baby. How is the growth of the baby going on? We should know all these things at this time. Generally, everyone advises you to get a sonography and color Doppler done. So friends, this was my video on 25, 26, 27, and 28 weeks of pregnancy. I hope that through this video I have cleared some doubts in your mind and it will be helpful to you.